doing well, eh? So, yeah. So it's a pleasure to introduce our main speaker today, who is Professor Duane, who is one of probably Trinity's the leading expert in sustainability and health. So he's going to give us a talk, and then we have some other distinguished visitors who are going to join the panel afterwards. So thank you very much.
Thank you very much. Thank you for having me here today. It's difficult. We've got 40 minutes. It's a huge topic, and I'm never really that cognizant of the group that we're going to be working with, whether it's going to be healthcare professionals, whether it's going to be people, more lay people who are interested in healthcare. There's a huge amount of information that we can talk about in healthcare sustainability. So, great. So these are the aims of the presentation. So can you see that? That's great. Can you see that okay? Okay, great. Just looks, I think it's just my angle. So what is the relationship between climate change and health, and then the relationship between healthcare and climate change? What can we do in our healthcare systems? A very broad, sweeping fashion, and how do we measure the environmental harm? We know, and actually I didn't know this until I was in Brussels earlier on in the week. Nice climate, nice bit of plane travel there to add to my huge personal carbon footprint, which I justify as to spreading the word of carbon footprints. But Europe is warming at twice the global average rate. I didn't know that. So the world is warming, but we're warming twice as much. And the year 2020 was met with extreme heat. So all of these things, right? The average, these are supposed to come up with animations. I failed already. But the average temperature is up. France had its driest January. Spain's water reserves. I was in Barcelona a few weeks ago, and Barcelona's water reserves are down to 19%, which I think is horrendous because it's February. And then the melting of the Greenland ice sheet continues, and we've lost, with the sea level rise is going up another 1.5 centimeters, which doesn't seem a lot until you realize that that's escalating. And what I often do, and I haven't done in this presentation, is that I show a map of what Dublin would look like if all of the ice caps melted, both the across the world, including Antarctica. It raises the sea level by 70 meters. I'm not sure even if we're safe there. No. And I think this is quite interesting. This is greenhouse gas emissions by sector. In Ireland, we had a bit of a peak in 2017 in our agriculture, but mostly it's like looking generally, it's good, right? It's going down, we're all good, until you look at China. And remember that we export all our problems to China. China, we go, oh my God, it's disgusting. The Chinese greenhouse gases, the footprint, it's horrible. And yet, think about the clothes that we wear in the room. If we all had to take, if I said to you, anybody wearing Chinese clothes, take them off now, we'd probably mostly be naked, right? All of the bags that we have, the pens that we use, the chairs that are made here, like this huge amount in China, we've just imported, we've just exported. So please do not let us pat ourselves on the back when we say it's great that Europe has reduced its climate footprint, because we've just given it to China. We're still buying, they're still investing hugely in coal power, etc. It's not good. But it's a really good way of the Irish government saying, great, we've got this sorted, but we haven't sorted it all. So how does climate change affect health? This isn't the reason for today's talk, it's how does healthcare impact the climate? But I wanted to spend a few slides talking about that because it's important to know the difference. And climate-sensitive health risks, for huge numbers of reasons, they affect our air quality. So you think about all of the, I'm going to turn it back to the healthcare sector, you think about all the pollution coming out of our hospitals, all the medical waste that we incinerate that we don't necessarily need to incinerate. We could recycle a lot of our healthcare waste. That's causing problems for our air pollution. So we do all of these things in healthcare to protect our patients, and then when we let you go out the door, you then breathe in the incineration, the particulate matter, and all the stuff that we do. It is going to cause food and water security issues. It's going to change disease. In Brussels earlier in the week, there's a lot of talk about River Nile and how tiger mosquitoes are coming further north, now affecting Barcelona. And then I had a coffee break with one of the World Health Organization people, and he goes, oh yeah, we smother Barcelona with this, they do drops of insecticides, and it really affects population health because it's not good for you. And there's also no evidence to suggest that it does anything either for the mosquitoes. Extreme heat and weather, we noticed that, right? We have decent summers now in Ireland in the peak of the temperature rises we had in summer. I think Edinburgh, where I was in the weekend, got up to 27 degrees. Which seems really nice, but of course it's going to have huge impacts on our biodiversity across internationally, and then the social impacts, both from the heat and also mass immigration. Water levels are going to rise, and these people need to go somewhere. I do say that Ireland is going to be fine. We're wealthy. We'll just move out of Dublin up into the hills. And remember, this is not about how the planet is going to survive. The planet will be fine. This is about how us as humanity will cope, will not survive. And a whole lot of climate change things happening there. It's mostly the same diagram, just slightly different. And the key focus areas on the World Health Organization are we need to address the wide range of health impacts. So we need to do more research into like the river Nile virus and all of the things that are happening. How are we going to address the huge heat changes? How are we going to build better for climate change? How are we still building right down on Dublin's waterfront? We probably shouldn't be. And also strengthening climate resilience. And all of these things. And I think when we've got a few leaders in the room here, we're thinking about all the things that you can do. So it's not just measuring your climate footprint. It's about how do we adapt. It's about this kind of thing. I do this with my mouse. So it's not showing there it is. Yeah. Anyway, sorry, I stopped looking at that. It's what we can do in climate research. And I'll talk about my Horizon grant that we got awarded last year from Trinity that's doing more in kidney care. But there's a huge amount of research that needs to happen. And this might be like a tiny 20,000 euro grant for seed funding. We were lucky because we had Enterprise Ireland give us 10,000 to help us write this big Horizon grant. So we've now got a 1.5 million coming into Trinity to look at kidney care. So it's about research, it's about building our health workforce. We've got a certificate in sustainable healthcare that we're launching in Trinity. We're really keen to get some of the HSC, some of our health colleagues on that to try and upskill them to the knowledge that we have. And our knowledge is still rudimentary and still growing. What leadership do we have? Is the CEO behind the health changes that need to be the organizational changes that need to be happening across health structures in Ireland? Are we financing? Are we still buying shares in Shell, etc.? We need curriculum change down the left here. There's a huge amount that we need to do for climate change. And this isn't really thinking about health systems. These were just some things that I stole from DMR's slide on World Health Organization. We need a green climate fund. And we also need to be able to apply for some of the research grants. So somebody like me who's never, apart from the €6 million grant that I'm leading on from last year, I've never had a grant before. And this poses problems because if you've never had a grant in Ireland before, you can't bid on existing grants without being already a member of an existing grant. So there's all these obstacles, which is why most of my research has been outside Ireland. So you're kind of getting to understand the link right here. Climate change is causing problems. This is supposed to be a hospital on the right-hand side. Climate change is going to cause problems with our health. Now, health systems are going to cause problems with climate change, which is then going to cause health problems. How do healthcare systems affect climate change, and how do we measure it? So, my face is in the way of my slide. We can measure it by carbon. And that's starting to be a little bit traditional now, like everybody's doing carbon footprints, etc. But I'm going to talk to you about why this potentially is problematic during the presentation. We can measure things like bags of waste. And actually, the dental hospital just did an audit of their waste, and our carbon footprint of our waste, about 10% of our carbon footprint comes from waste, which is a lot higher than we thought. We can measure in how many miles our staff travel to work. Because don't forget, it's not just important how much patients travel, and we can maybe incentivize free public transport for etc. We can maybe incentivize some sort of financial payback if they come with public transport. If we're thinking about our holistic carbon footprint, we need to do that. And when we centralize healthcare systems and we build a huge children's hospital here, have we closed down a whole lot of other children's hospitals? Are we getting people to drive more? because healthcare executives will tell us that it's much better to centralize, much better to bring us all in one area, but it's not, because it's a huge amount of patient travel. And then we all breathe in the particulate matter, and we all breathe in the fossil fuels, and the healthcare system saves, you know, a couple of million a year, but the population has been impacted from that perspective. And when we're doing life cycle assessments, to explain what that means in a minute, when we're doing carbon footprints either, we assign our staff to the hospital footprint. So we'll say if this person spends half an hour of their day, then we will take half an hour of their 8 hours travel, and we will assign it to the footprint of the hospital. Do we measure in delis? I'll talk about that in a second. Or do we measure in electricity use or energy use? So how do healthcare systems cause climate change? I quite like this. So a deli is a measure of the equivalent of life years lost in terms of health. So if you lost a hand today, what would the rest of your life be? And they do this through patient value scores, but you might say, well, the rest of my life would only be 98% quality because I lost a hand. If I lost a bit of my lung, how would that impact on me? So we can turn it into disability adjusted life years, and we can see that the whole healthcare system in the US, causes about half a day of disability adjusted life year per US citizen. I would say it's much higher than that. Here, this looks like a complicated diagram, but let me talk you through it. Around the circle here is the greenhouse gases, the particulate matter, the nitrous oxide, the sulfur dioxide, the malaria risk, the nitrogen, the scarce water. And the letters are the different countries. So you can see the USA, if we talk about greenhouse gases, I would love it if my Zoom camera wasn't in there. Right, we can talk about the US, right? The US has a ridiculously inefficient, huge healthcare system. It provides amazing care for a small amount of people. It provides care to the poor, and then you've got this whole group of middle class that can't afford to go in. And they're charging you, huge amounts. Just saw on Instagram recently, someone's charged £1 million, dollars, for a bike accident that he had to have in hospital for 8 days, etc. We all know how expensive the US healthcare is, and because of that and the amount of resources they use, particularly for the most empowered rich people who have really good insurance policies, they have a really high carbon footprint. Interestingly, and we're looking at the top there for greenhouse gases, carbon footprint. Interestingly, Japan does, and so does India. I'm not sure why India would. I would have thought their carbon footprint would have been smaller. And then we've got the UK, which is shown as Great Britain in this case, Brazil, and China. The UK's carbon footprint is quite low because the NHS would be regarded by many as one of the most efficient healthcare systems in the world in terms of equity, in terms of the value you get for money. But then you have all the other things happening, the particulate matter, the little tiny bits of microparticles that come out of people's exhaust that we all breathe in as we walk through Dublin, the nitrous oxide, the sulfur dioxide, malaria risk, etc. I'm just going to talk through some of those. We know from an air pollution perspective that we all lose, depending on where you look, about between 1.5 to 2 years of our lives due to just air pollution. And we know that the healthcare system is, compared with, if you're just looking at carbon, we're contributing between 5 and 10%. So if you think about that and you extrapolate it, the air pollution is causing huge issues with human health. And it's quite a good question to ask people when you say, I'm just so sick of cars, I'm just sick of breathing and all this stuff. And they go, chill out. And you're like, well, do you know how many years people ask, like this, my adult children, do you know how many years people lose to health? And they go, oh, a month. Yeah, it's quite startling. It would all be 1.5 to 2 years longer if we didn't have the pollution, and huge part of that is our private cars. So we have different greenhouse gases, and I've never, in fact, if somebody asked me to tell you what a direct emission, what an indirect emission, what all other emissions were, I would still not know, despite having 15, 20, maybe 30 papers on life cycle assessment now. I'm not bothering. I don't really think it makes much sense. I'm more interested in this, which is the NHS in England, carbon footprint. And you can see huge amounts comes from the stuff that we buy. 30, 38, 48, 58, 62% comes from the stuff that we buy in healthcare. And that means we have very little control over the stuff that we buy, unless we're a huge organization like the APCC. Even a dental hospital has a huge enough budget to make a difference, where we can start saying to people, this is what we want you to do in terms of how to reduce your carbon footprint. You want products that are bought locally, products that are recycled. We want our procurement people ideally to take care of their waste. I bought a MacBook today for the research grant. Even the MacBook comes in this ridiculous box, a box within a box within a box. And how can we reduce that? And surprisingly, also anesthetic gas inhalers, 5%. That's quite a common point now in healthcare, looking to make sure that we give people the right type of inhaler. And then your staff travel, your community visiting travel, which is in the country. So we have the HSC Climate Action Strategy, and I'm going to touch on this just briefly. I think it's really useful. We need to align HSC purchasing decisions with the HSC decarbonisation, and maybe we can touch on that in our panel, because this isn't my expertise. I'm just grabbing snips from the World Wide Web. This is a questionnaire that we produced a few years ago for a dental journal, maybe 5 or 6 years ago now, because I like the stuff that it talks, and it makes it sensible for me because I understand it because I wrote it. But we need to think about where the product comes from. And when we talk about toothbrushes, for example, it's much better for us to get them locally. If that's not Ireland, at least somewhere within the EU rather than China. It also depends on how the product comes. If it's flown in, a lot of our products are flown in during COVID, the footprint becomes ridiculously high. But don't forget also the countries in which we need to get all our healthcare stuff from. If we're doing it in the UK, if we're doing it in Ireland, if we're doing it in the EU, we have appropriate protections to keep our staff healthy, to keep our employees healthy, to stop having accidents, etc. And a lot of that in other countries doesn't happen. So it's also about sustainable from a social perspective. Is the product packaging recyclable? Is the product recyclable? Can you, at the end of its life, take it apart? Has it got a whole lot of screws, or is it easily taken so that you can break it into product A, product B, product C, and get it into the recycling lines? That's not always easy ever. Would the supplier be prepared to collect all packaging? I would love that. I would love that at Amazon, for example. They would just collect their packaging, because I think they would immediately do something. And I think manufacturers, if we gave them this task and compensated them appropriately, if we said to them, you need to halve your carbon footprint in the next 3 years, and we will give you X amount of euros, or we'll pay you 20% more, or whatever, they would do it instantly. I think we underestimate how manufacturers could do this, but it's not the priority. And as soon as they get some sort of financial issue, some wavering in their accounts, they will dump sustainability. That's the problem. We need to make sure that it's important for us as for them. How do we reduce our waste? A lot of the stuff that we've done in healthcare looks at making sure not only that we're buying less and we're having less waste, that we're not contaminating our cardboard so it somehow ends up in the medical waste, and we're throwing ridiculous amounts of stuff into the wrong type of waste. We need to make sure that the waste goes to the right place. But there's a lot of stuff that we can do with medical waste now, that it can be sent off, it can be shredded, it can be autoclaved, it can be washed. It can then go through a normal processing, and it can be reused. So we have to get our heads around that, and we have to have waste companies within Ireland that can actually do that for us. How do we improve on energy efficiency? Sometimes I think we can get carried away. These are a whole lot of dental items and I tell people that if it's a little item and that you're not charging it much, don't worry about it. There'll be a whole lot of things in your houses too that you don't worry about until you go and you buy an appliance. Like you can buy on Amazon for about 20, 25 euros, which is a plug within a plug, and you plug in all your appliances and then leave them for a couple of days, and then you start. This for me has been a real behavioral change process, because you can see that the big items down here, your energy efficient TV. It's interesting to know as we speak how many in your houses have that little red light on, and where that little red light on your TV, and in the hospital, and now we have huge screens right through the dental hospital. They are burning a huge amount of energy. You can kind of tell crudely just by putting your hand on the device if it's in standby, and whether it's also can be used as personal reset. But I suggest for those of you who have a bit of a family home with a few appliances, buy one of these devices. There, just put an electricity measuring device on Amazon. As I say, they're just a plug within a plug. You plug your TV in and leave it on standby for a night. See how much, because I worked out my friend's 1980s stereo just left on with a little red thing going on standby. It was costing him €60 a year, just because he couldn't be bothered turning off his radio. And there'll be some standby TVs that'll be ridiculously efficient. And you think about that, you add all those TVs across Trinity that's currently with their little red light on. Even those of us in the room who have the red light on, I turn all the devices off if I'm not using them, including my microwave, because I don't trust it. I just don't know how much it uses. But equally, why do you need the clock on? You know, we all have smart devices now. We know what time it is. We don't need our microwave to tell us. So again, how do we do this? And how many times have we walked through St. James now? Every single office, how many computers are left on? You do the maths. It's probably 50 to 100,000 euros a year. So it's worth employing a staff member to go through to turn them off. How do we use our water? I'm kind of trying to go through that diagram we showed you before, because I was interested that healthcare is using scarce water. It's not really using it as we would first think in its hospitals, but mostly apparently it's using it through the supply chain. So all of the stuff that we buy is using a huge amount of water. And again, it's part of the FTSE. Particulate matter, haven't got anything about that, but lots of fossil fuel cars being used to transport our patients, to transport the goods in, etc. And how do we reduce that? Nitrogen oxide and malaria risk is an interesting one. The nitrogen oxide comes again from fossil fuel burning when it's really high in healthcare systems. The malaria risk comes from global consumption and deforestation. It's changing malaria risk. So healthcare systems ironically increase our malaria risk. Sulfur dioxide, again coming from coal and fuel. So getting rid of our cars and making them more fossil fuel free is going to be huge, but also, yeah, it's about going across the whole procurement system. And that's huge, particularly because we want our products to be cheap. That's not always possible, cheap and sustainable. And how we travel, and much better to travel with 4 passengers in a car. I always find this interesting though, that people vilify cars and they'd rather drive 1,000 kilometers than fly for 1,000 kilometers. There's not a huge amount in it. The difference being is that domestic flights also cause other but they also have this additional effect of flights are bad, particularly flights, of course, across to the States or across to New Zealand, where I'm from, etc. The carbon footprint is horrific. When we're thinking about how to change things, I created this. It was for my sustainable dental building blocks, but it's adapted from the World Health Organization, and we need to look at all of these 6 things. We know that we need to rapidly increase our knowledge of our health workforce. We also need to make sure that we're getting the patient to use the standardized way, the patient at the right time, at the right place. We need to make sure that the patient doesn't drive in and we don't have the right records for them, they have to drive back. We may need to make sure that our staff aren't hanging around while our patients don't turn up. We need a much better IT system so that we can make sure that we know everything about a patient. Ideally, that we could risk assess them, and that we could target our healthcare towards our high-risk patients and provide prevention. We need access to essential medicines. If this is a dental talk, I'd be giving you the example of like free toothpaste. Why do we charge people? Why do we give people free dental care, but we charge them for toothpaste? What other things could we be doing from a prevention perspective as a society to reduce our impact? We need to look at the way we finance. Generally, it's much better to not have insurance in your mix of how we finance a healthcare system. But then all the stuff on the side here, the leadership and governments, how many leaders have we got? This has rapidly changed in the last few years, but 10, 12 years ago when I started with sustainable healthcare, there just wasn't the leadership. and that is growing. So how do you measure the bottom line? The triple bottom line for me and for most is about people, profit, and planet. The planet being not just carbon, profit, we understand, finance, but also its effect on people. We can look at carbon. We can either look at carbon, measuring it through some financial model where we say for every euro in a particular type of procurement category, we have a conversion factor and we calculate the carbon footprint. It's quite crude, but it's quite quick. Or we can do life cycle assessment to calculate the footprint. This is the dental one. It's quite interesting also thinking about the dental one, because I think we probably need to move away from whole healthcare carbon footprints to industry specific, because you can see the dental one, most of our carbon footprint comes from patient travel and staff commuting. So maybe we need to do a carbon footprint for podiatry, for nephrology, etc., etc. The LCAs, the life cycle assessments, which is where we take a product from its production, whether you're growing it, etc. I've been involved in, say, about 30 of these life cycle assessments. They're a much nicer, more accurate way of creating carbon footprint, and I would urge people in healthcare to start using life cycle assessments more, as particularly for their really expensive products, the really resource products, to try and work out how we can manipulate this life cycle, manipulate this pathway, how this product is reduced, and reduce the carbon footprint along the way. We can grab all of these different healthcare, these different environmental things on the left-hand side, and we can actually convert them into different things. So with the ozone formation, the particulate matter, the ionizing radiation, the climate change, we can say if a product is causing all of these things, then this product will also cause this amount of disability adjusted life year. So we can start to get a climate change element on them. But look at this. This is hand gel. This is we have something here. This is a footprint of a hand gel that we did during COVID, and you can see that the climate change isn't the issue with hand gel. If we had just done climate change, it would have stopped us from seeing that the main issue when we look at these impacts is actually photochemical ozone formation. And if we were using this as per the World Health Organization recommendations, it basically had a huge impact. And photochemical ozone formation causes smog, and then smog is on the right-hand side, then has an impact on low socioeconomic groups. So it's really important to understand the consequences of just using carbon and the stuff that you can miss out on. So how do we measure environmental person-centered harm? We have these disability adjusted life years, which I think I talked about before. It's the number of years lived with disability, illness, or injury, plus the years of life lost, and we can create some interesting figures for them. This is delis on the right-hand side here are also with the climate change. And you can see that just because a product, and this is a bamboo handled toothbrush, has a low carbon footprint, and even more so a plastic recycling scheme, you can say, right, therefore we will use plastic recycling in terms of our toothbrushes. But if you look at, and it's useful to look at delis too, because you can see that bamboo does cause a lot of human health harm if we're just looking at disability adjusted life years. We also need to look at the financial costs. What does one element cost compared with another one? But also what cost is a particular patient pathway compared with another patient pathway? And this is why I said it's important that we look at not only the cost, not only the environmental cost, but also the social impact. How much human health harm, for example, I don't know where this is made. Our site is no longer young enough to do that quickly. Oh, wait, it's made in Ireland. So yeah, how much is this? How much does this have an impact on its workers? If we look at the next slide, you can see here, this is a list of all the things that we look at when we come to analyzing a product from a social value perspective. So we might say it has the best carbon footprint. This product made in Pakistan has the best environmental footprint out there. It has the lowest carbon, but then we would say yes, but if we produce it in Pakistan, for example, these are all the things that we have to think about. We need to think about child labour excellence. We need to think about corruption. We need to think about health, gender wage gap, etc. So this is why I would advocate that we shouldn't just look at what product is cheapest, which is what we would have done right up to now, but we need to look at the environmental impact, because the environmental impact is also really harmful from us from a cost perspective, but also where it's made. And we also need to look at the health outcomes from a particular pathway. Just to finalize, I'm just going to spend a few minutes on our new project, new brand new coming. We, as I say, Trinity is leading on a €6 million Horizon grant. What we're specifically looking at is kidney care, because the cost of kidney care is between 2 to 5 or 6% of healthcare budgets, but the environmental footprint is 18 times the average healthcare carbon per patient. People are using a huge amount of water, a huge amount of energy, transport waste, greenhouse gases, as you can see in that bottom diagram. But we're also looking at social value, understanding where all these products are made, and also what people want in terms of what pathway they want, what product they want. Do they want home-based dialysis? Do they want in-center dialysis? And also the health outcomes of one compared to the other. This is an example of how much water a patient can use in an average week, between 300 to 600 litres of water. It's discarded directly, but it often does come in a lot of plasticated containers, etc., especially if you do it from home, because you need ultra pure water before it starts to be used in the dialysis process. We hope in this project to improve knowledge. We're going to do a huge amount of environmental footprinting of all of the different kidney care pathways, not in Ireland randomly. We're just leading it. We're going to be doing it in Utrecht in the Netherlands, in Madrid, in Italy, and in Poland. We're then hoping to use a lot of life cycle assessment processes in order to try and optimize the different types of care that's happening. And then, as well as that, developing a life cycle based benchmarking dashboard so that decision makers, senior managers, etc., in healthcare can understand that whatever process they're using, how does that come out in terms of its environmental footprint, its social footprint, its health outcome, its cost. And we hope to tie that to an accounting system. And these are just, again, the different things that we are doing. Like the Planned Use Study Act, the quality improvement, to try and look at seeing what's been done in other sites and how can we learn from what Madrid is doing better or what Poland is doing better and push it across different pathways. We want to look at some tech stuff in terms of reducing products that would reduce water or reduce travel. And then we want to come up with this really cool for impact benchmarking tool so that people can quite quickly understand what impact each patient pathway has. And then we'll come up with a series of recommendations for the system. We are also keen to engage in Ireland. We just don't have you funded as a clinical centre. There was reasons for that, because we needed to make sure that our Horizon grant wasn't too UK Irish focused, especially with Brexit. People still about Ireland. I think it's a new Brexit funding. I often have to tell people that no, we're a separate country. No, we don't have the NHS. No. So conclusions: climate change, of course, is health issue. Of course, is climate change. Beware of just carbon footprinting and the consequences of doing quick carbon footprinting. I would urge you to embrace life cycle assessment for people who make these decisions. Consider the social, health, and environmental and financial costs. Consider a World Health Organization structural change to basically break down the system that we have. And also consider how Irish academia will respond to this rapid change. We need to have the intelligence and the intelligent capacity in our organizations to be able to bid on these funds and to bring a lot of this research into Ireland. And I do think we have that ability. Amazingly to time.
Has anyone any questions or comments that they'd like to put to the panel?
Well,
Yeah.
I know all this climate action is recent and everything, and you're doing great participation and everything like that, and that's fine. But I also hear, isn't it some road that's going like this with the medical care here in diabolical situation where children, everybody is, there's lists of people that, like, I mean, the money that's going to say whatever yous are doing in climate action and all that, is it not taking it from the real medical care where people like children with scoliosis and a lot of things that are up to date at the moment, you know, the real medical, the people that really are needing for cancer treatment and all that, is that another, where does that climate action sustainability, I mean, that has always existed anyway. What part of budgeted or
Yeah, no, I think that.
You know what I mean?
It's the hardest question.
Is this a new idea of?
So-
It's about climate action. But the real thing is the medical care as well.
The causes of disease is caused from the environment, and we're not talking climate change. I'm talking, you know, poor foods, inability, can't access preventative products, etc. And we have this, but so all of the environment causes this huge healthcare change, but we don't invest in the environment. We simply spend more money on the healthcare system, so we don't actually make it right. Somebody, I would argue that we need to take 90% of our healthcare money, just a little bit of experiment, and say, sorry guys, and actually stop people from getting sick to start with. I'm not saying that you should do that, but it's one perspective, because we do, and most of us in the room are probably in reasonable middle class society. If you talk to somebody who's 20 and seen the life that they've had and the environmental impact, their social determinants, the fact that their kids, their parents are unemployed and were taking drugs and etc., and the state that they're in, the state of their general health, it's really, really poor, because we're not, as a healthcare system, investing in general public health, because we're spending it all on what we have to spend on the people with disease. And I get that as well. If I had a life-threatening disease, I'd want that Ireland to spend as much money on me as they could, but it's finding that line. Now, climate change has always been around, I guess, but we're only starting to realize how huge climate change will be. We will look back in 20 or 30 years time and we will feel ridiculous about the amount of stuff that we do. And I think it's easy for someone.
Yes.
Remember when
No,
isn't it a progression?
No.
I know
you were totally off the mark. Sorry. I really have to interrupt you there, because if you read any of the international government intergovernmental panel on climate change, which are the conglomerates of the world's scientists, and if you look, and it's not just healthcare, it is meteorological, it is everything else, you will see that there is a proof beyond any reasonable doubt that yes, the current warming of the planet is caused by us. It is caused by human activity. And yes, planet will survive. We might not. And yes, it will get worse unless we change tack like this. And to answer your previous question, is there any funding that is being put into our work taken away from medical care? I nearly started laughing because I wish we had any funding. All of the stuff that you have heard, it's all on a wing and a prayer.
There's no funding, there's no ring fence funding for this program. There's literally my resource, me and a small bit of some other resources.
There's all of the papers that I've written until like June last year, and that's like 100 of them had been written as a researcher who's interested in this topic, and who does it in, you know, the odd time that I get for research in the dental hospital, which, to be honest, it's a day or two a week, but also the evenings and the weekends because I'm passionate about it. Because there was no funding. I would try to apply for funding. People would go, sustainability. Yeah.
Okay, can I just?
I'm not paying for anything I've done for sustainability.
Sorry, there's another question down the back, Julia.
Non-contaminated or not low risk clinical waste in general. It's a big Especially since COVID, we stopped. But, so there's vast amounts of plastic, things like speculums and couch roll and. Are you aware of any company or anybody who in Dublin and Ireland who is willing for that stuff? Like, it's not, it's waste.
Yeah. Well, maybe just to say on that, there's two of the work streams that would be looking at that. So there's the greener model to healthcare, which would be looking at kind of, you know, our models of care, how we deliver care and, you know, theatre practices, GP practices, etc. And then there's the waste elements, and also there's the procurement. Nearly three kind of the work streams that need to kind of interject. And we are creating a smaller subgroup, which will look at procurement of items such as theatre trays, such as trays for general practice, all of that stuff. And I know we've had a lot of companies come to us from a green perspective to meet and, you know, talk about their product. And this is going to be like a kind of holding bay or place where all of these companies will come to discuss. So I don't have the answer, but it's certainly up there in terms of the work plan and some guidance and recommendations to come out around that.
Sorry, the other hand went up there.
If I may just interject, I can tell you on behalf of what are we doing within the Tallaght Green Committee. So we are looking exactly at that. For example, at TPN containers, total parental nutrition containers, which haven't been in any contact with the patient. The problem is that waste providers are, the moment they think something has touched the patient or could be infective, they go whoop and put it into the bunch of clinical waste, which first needs to be sterilized and then incinerated. So the climate footprint of clinical waste is massive. So our thing in the healthcare needs to be that we first put into clinical waste only what is actually clinical waste, and then that we talk to our waste providers and explain to them that clean waste, clean plastic that hasn't touched the patient or that has been washed, or that we need to create pathways for that to go at least into solid fuel recovery. And that's the very minimum. Plastic cannot really be recycled. We really need to be moving both from health perspective and from the climate perspective away from plastic. If you look at the Endocrine Society guidelines, they tell you don't drink from plastic, don't eat from plastic, don't heat your food in plastic. So like as a civilization, we need to move away from using it. But like I could talk about this for about 3 hours.
Okay. Do you want to say something, sir?
Is the problem being is when you recycle plastic, 12% is a study in Strathclyde last year. 12% of the plastic that's recycled ends up in the water and ends up in the pipe out of the wastewater thing. So 12% is microplastics. 12%. So it's I kind of agree with you. I see people in my gym sauna drinking from a plastic bottle, and I'm like, that plastic bottle is warming up and you're getting microplastics. They look at me like I'm an apocalyptic freak.
Yeah.
But I tend to agree. I think we need to move away from plastics. But plastics have quite a low carbon footprint. You know, if we're growing everything, we're going to be chopping down even more rainforest, or, you know, and reducing our biodiversity even further. So it's like, it's a need to do this huge amount of work. And
there is the first thing is convincing people that this is real, that I am not some freak hippie who is, you know, just kumbaya.
tell me about it.
Paralysis. I think there's a bit of paralysis in that people think, oh, it's too late, and there's
No,
a bit of
there
that
isn't.
as well,
It isn't.
which was absolutely not. You know, we all need to change the way in our own homes, in our work, everything. So
Can I just check, is there anything in the chat? Because I can't see it, so I don't want.
Somebody has kindly pasted some references on.
Don't want to ignore people at home.
Thank you, and Helen pasting some references on HSD.
So I'm very conscious that there's people, yes, John, go ahead.
Working down. That's the journey. Even from our point of view, we've expanded our footprint in the last couple of years, but our energy has actually reduced.
Yeah,
So
that's
all
true.
about efficiency. So we now know that our campus is bigger, but actually our efficiency use Some of that is driven by costs, and will be reinvested into healthcare, but I think it's around efficiency. You mentioned in relation to like a lot of new builds, we have the next one automatically what.
Yep.
So we're saving a lot in relation to those. And you've led in relation to theatre castles, in relation to making sure, like Karen Hill, there's lots, so they, and even us in relation to procurement, all contracts, we go out, it's now listed, it's stored, there's a storing associated with, you know, energy. And sustainability. So I think, so in relation to, I suppose, from the point of view, we as, there's a lot of waste that goes out of the hospital every day, and we have a responsibility to make sure that we're improving on that. And you definitely, the train has left the building, so, and you started us on that, and more people are jumping on board. Like, it is leaders like yourself in relation to change, because it's not easy. You know, there's a lot of things, it's easier maybe to continue to do what we're doing in relation to actually what we're trying to change in the future. Even now, if we look at a building, we say, actually,
yeah,
I'll give an example, we're looking at buildings because we don't have enough space. If the first consideration is that building sustainable? And if not, that might be the first decision to say we walk away on that basis.
The problem that I have though is that if you did a carbon footprint, just a carbon footprint on the new children's hospital that seems to grow bigger every time I look at it, and divide it by how long would that be used for 30, 40 years before we think about removing it, divide it by 30 or 40 years, then divide it by the number of patients that are going to go through it, and then assign that carbon footprint to the patients, park it there, and then think, okay, so what if we just use the traditional, you know, old hospitals that we have, and then do the carbon footprint? We never think about, we don't carbon footprint the new buildings. We say this new building, this new building will reduce energy by 62%, whatever. This building will do this, it'll have the lights, but we don't. And I'm not mocking what healthcare systems do, because it's great and we're moving that way, but we need to think about it as a holistic carbon footprint, because otherwise we're just fooling ourselves. But I you know, definitely great. HSC is doing a lot. I think, you know, we are as an islanders. It's really difficult. We can only do what we do, but we always need to constantly change how we think about things.
A lot of us in the room are actually users of the health service, and I'm just wondering, what can people who use the health service, how can they contribute to this? Like, if they're going in and out of hospitals, or what way can each of us make a bit of a difference?
Well, there's, I suppose, as part of the climate action strategy, that we will be hopefully rolling out some patient education around, you know, the strategy and how they can, and we have an internal staff communication campaign at the moment, but the next phase will hopefully have some information for patients. But I think, you know, there's things like we are trying to roll out e-health and the use of IT, but I know that doesn't suit everybody either, and there's a place for that, and there isn't in other services. And it's also, I suppose, accessibility to services, walking, taking the bus, and trying not to drive if you can, if it's within reach. Also, I suppose, coming back to what you were saying earlier, Brett, it's taking responsibility for our own health, and it's that preventative piece, and trying to, you know, really do take on board responsibility for yourself, and, you know, walking, healthy living, healthy eating, sustainable diets, all that kind of thing.
I'd say the first thing that everybody here is a citizen. So use your vote. Pester whoever's going to be coming in the next year on your door. And I'm not saying vote for any particular political party, not whatsoever. Every political party needs to be pestered on what their plans for sustainability is. What is their plan for your particular area, which may be within the 70 meters that will flood? You know, these are the things that we need to start. We need to get political, but not political in terms of party politics, political as in the ancient Greek sense of the word, of polis, of being part of the square, being part of those who make decisions. So if we all take individual responsibility, not just for whether I buy plastic or don't buy plastic, and what does my small carbon footprint do or doesn't do, but how do you start a conversation everywhere, wherever you are? Ask the politicians will want to know, they'll be knocking on your doors. So if that is one of your questions, they're going to start paying attention. Get active in your, I don't know, tidy towns, biodiversity groups, plant a back garden, create a corridor for bees, whatever takes your fancy. But think of how to change the world in your everyday actions.
Thank you. You have a question there, sorry.
Yeah, I think there's a hell of a lot of waste in the drug system,
Yeah.
Yeah.
you know, and I think that the drug companies don't provide any interest in, they're just laughing all the way to the bank. And like we have become a society of pill popping, we have to have a pill for everything. Whereas years ago, if you felt ill, you'd give yourself 3 days and it'll pass, or else you'll have to go to the doctor then. But immediately we have an incident, we have to see the doctor or the hospital. And like the A&E, to me, in my opinion, is full of people who think they're sick, but they're not. So like we're using a service that should be kept for real necessity. I think there's a lot of research could be done on that scope. It's to finalize where the waste can be used properly.
But there's a lot of that, but there's also a lot of thinking. Like my mother wouldn't be 85 without modern medicine. So like there swings and roundabouts. But what I think we do need to think about in terms of medications is, yes, deprescribing. If I'm a doctor, I prescribe. I am trying to think every day in clinic, does this person actually need this drug? And that is one way of looking at it. The other way of looking at it is, if you have given a medication that is necessary, all of those medications are coming through our bodies and into the sewage system. So how are we, and this is why I'm saying get political, because systems change comes from governments. And if you ask for the sewage system to incorporate filters that take out medication residue so that, I don't know, the fish in the rivers don't become all female from all the oral contraceptives and HRT pills. Like, I mean, that's a really.
I'm conscious that we
Yeah,
have,
sorry.
there's a person behind you who has their hand up. Yeah.
About 6 or 7 years ago, meeting at Fox based in the Netherlands. Our full-time job, which is not the only one in our practice, as pharmacists, if any of the patients in our GPs at the general practice were on more than 5 medications, she would sit there and go through. Now, I'm at the stage, most of my friends are, a lot of them, some of my friends are on multiple medication. Nobody has ever spoken to me about reducing.
There is actually a study being taken place with driven by the HSC with colleagues in the north on that, and probably lifting that model and doing that here. And it's proved really, really effective over north and south. And there's been pharmacists, I suppose, funded through research to bring this to the point where now we know this is really effective. So we're hoping to roll that out. So exactly that people can sit down, go through their meds, what's appropriate, what's not appropriate. Yeah.
I think it's also, the doctor needs to say to people, talk to us about your medication. Because unless you say to the doctor, can I reduce what I'm on? Am I really necessary taking those?
Yeah.
It's not going to happen because the doctors don't have time to go through every patient and see what everything they've been on.
Sorry, you want
Very briefly, just on the pharmaceutical industry, which, I mean, everybody understands and realizes is multi-billion euros and $1 billion. Can any pressure be put on them by the government to, obviously, they're going to continue making a lot of money, but could some of that money, maybe 5-10%, be, taken from them and put towards research?
carbon tax.
Carbon tax, and
Yeah.
Talk to your
TV, that's a good, that's actually a brilliant place for us to stop because we have run out of time. So I think the clear message is we've got a problem. We need to accept it and we need to talk to our TDs about doing something about it. So thank you very much.